the training that I do with my patients, and especially patients that are new to HAE or have never given themselves an injection. This is what they call a subcutaneous injection that you're going to give it to yourself in your abdomen. I take my time when going through the process, making sure that the patient has the opportunity to ask me questions, express their concerns, express their fears without any fear of judgment. So I do my best to support them, talking them out and showing them step by step exactly how to do the injection. But then the piece that comes after that is also letting them know that we're here for them. We're here to support them. So if they have follow-up questions, if they have concerns, they can call me, they can text me. I'm here for them. Typically, of course, the first time is usually the hardest. But after that, most patients say to me that they got it, wasn't a big deal, they're good to go.
Indications and important safety information. Indications. SAJAZIR, icatibant injection, is indicated for the treatment of acute attacks of hereditary angioedema, HAE, in adults 18 years of age and older. Important safety information, warnings and precautions. Laryngeal attacks. Given the potential for airway obstruction during acute laryngeal HAE attacks, patients should be advised to seek medical attention in an appropriate healthcare facility immediately, in addition to treatment with SAJAZIR. Adverse reactions. The most commonly reported adverse reactions were injection site reactions, which occurred in almost all patients, 97%, in clinical trials. Other common adverse reactions occurring in greater than 1% of patients included pyrexia, 4%, transaminase increase, 4%, dizziness, 3%, and rash. Post-marketing experience. The following adverse reactions have been identified during post-approval use of icatibant: urticaria. Drug interactions, ACE inhibitors. Icatibant is a bradykinin B2 receptor antagonist, and thereby has the potential to have a pharmacodynamic interaction with ACE inhibitors, where icatibant may attenuate the antihypertensive effect of ACE inhibitors. Clinical trials to date have excluded subjects taking ACE inhibitors. Use in specific populations, pregnancy. Available data from published literature and the pharmacovigilance database with icatibant use in pregnant women have not identified a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for icatibant and any potential adverse effects on the breastfed child from icatibant or from the underlying maternal condition. Pediatric use. Safety and effectiveness in pediatric patients below the age of 18 years have not been established. Geriatric use. Elderly patients are likely to have increased systemic exposure to icatibant injection compared to younger, 18 to 45 years, patients. No dose adjustment is recommended. For more detailed information, please refer to the full prescribing information at sajazir.com/pi. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-800-836-4380 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.